Hi, everybody. I'm sure
Hi.
you all know I'm Christine LaFontaine, and I am the research navigator for the C3. Thank you all for coming today. So today we're going to be talking, just having a C3 chat about access and care outside of Canada. I've specifically asked three of our patient members who I know have been outside of Canada to kind of talk about their experience, and then we can just kind of open up the floor and have a bit of discussion and answer any questions if we can, because we don't. I'm not purporting to be an expert in this area at all, but I'll just quickly go through my slides, and then I'll ask each of our patient members to kind of give a little bit of a background on why they chose to go outside of Canada, where they went and what they had done, and kind of anything else that they wanted to share. So just to start with, for biliary tract cancer care in Canada, so what's available is considered standard of care. So first off, if surgery is an option, that would be available. And then there is the adjuvant chemotherapy. So after surgery, you'd be offered capecitabine. And then there are local regional therapies, so like radiation therapy or arterially directed therapy. So TAE, TACE, and TARE, although TARE, I believe, is not funded. And then there's systemic therapy, which would be your chemotherapies. There's first-line chemotherapy, which is the gemcitabine and cisplatin, plus the durvalumab immunotherapy. And then the second line chemotherapy would be FOLFOX. And there are variations to that, but this is just kind of broad strokes. So what else is available? So things that are available that are unfunded or off-label or kind of in the research realm, those are the targeted therapies. So we've got pemigatinib and ivosidenib, they're both approved by Health Canada at this point. So they are available in Canada, but depending on the region, they may or may not be covered by your provincial health plan, although it's especially with pemigatinib, where it's in the works to go in that direction. The makers of ivosidenib, I believe, are waiting to see what happens with pemigatinib to see whether or not they want to go through that process or not. Once the Canada Drug Agency gives a positive recommendation that this drug should be reimbursed by the provinces, then each province has to add it to their drug formulary, and then people can get access. When it comes to a drug like olaparib for BRCA mutations, this is something that is approved for use and covered for kind of breast cancer, endometrial cancer, ovarian cancer, prostate cancer. But because Health Canada did not approve this drug for use in cholangiocarcinoma, it would be considered something that would be available, but available off-label. So again, you're either paying out of pocket or seeing if your private insurance can cover it, or seeing. And then the other option for accessing different, especially drugs, would be through clinical trials. We're not really going to go over clinical trials today, but that's just another way, another avenue for care, still in Canada. For complementary care, there are other therapies that do have some research evidence. Sometimes they're available through a naturopath, which would be hyperthermia, high-dose vitamin C, mistletoe extract. I know that there are some places in the States, like some hospitals in the States, that offer hyperthermia. But in Canada, it would be something that would be considered under the complementary umbrella. So, when you've kind of exhausted all of these avenues, or you want to see kind of what else is out there, there are other therapies that are considered standard of care or that are kind of approved for use outside of Canada that are not available inside of Canada, and that's what we're going to talk about today. So what else is available outside of Canada? You could be going outside of Canada for a second opinion. You could be going outside there are a few new therapies, like histotripsy and hepatic artery infusion. And though histotripsy is a machine that does high frequency ultrasound. So there's none of those machines in Canada. So it's not approved by Health Canada. Although, things are in the works with that company, but nothing yet. Hepatic artery infusion is having a pump installed into your abdomen with a tube that connects into your hepatic artery so that you can administer very high doses of chemotherapy drugs that stay in the liver, bathe those liver tumors in the chemotherapy drug, and then the liver itself is what breaks down the chemotherapy drugs. So you end up with a much higher concentration just in your liver. So it's not a systemic therapy. There is one doctor in Ontario who does this hepatic artery infusion, but he's currently only doing it for colorectal cancer patients who have metastases in their liver. Again, something that it's being worked on to expand that for biliary tract cancer patients. What else is available outside of Canada? So there are lots of other clinical trials. I'm not going to go into it, like I said. There is one place of note at the NIH, which is down in Bethesda, Maryland. And what's nice about the NIH is that everything that they do is covered. So I'm sure I've mentioned it to a few of you before, that if you do choose to go to the United States or outside of Canada for a clinical trial, anything that's considered standard of care that you could receive in Canada, that usually is covered by your personal health insurance. And so in the States, we don't have health insurance in the States. And so that would be considered something that you had to pay out of pocket. At the NIH, everything is covered. You don't have that kind of standard of care caveat. And then Cynthia said to write innovative combination therapy, so maybe she can explain what that means. So I think I'll start by seeing if Heba wanted to kind of explain her experience and where she went, and where she's from. So Heba, why don't you introduce yourself, say where you're from,
Yes,
and where did you choose to go to?
My name is Heba. Now today I'm 63 on May, if I live to May. And I was diagnosed at 59. I did the surgery here, the adjuvant treatment here. The tumor came back after a couple of months, and they insisted for me to complete the treatments of the adjuvant treatments, although the tumor is back, and it was very tiny. And I was reading a lot, and I asked it for gemcitabine cisplatin, and they refused. And after 6 months, I was told I have 6 months to live. And at that point, I decided to go to Germany. I heard about Dr. Thomas Vogel in Germany, and I told him what happened to me, and he said, "You will live, Heba." He gave me hope from day one. So I was like visiting him many times, like the best couple 2.5 years, and I was responding very well to the treatments. And before I continued with him, I took only one chemoembolization with him, and he advised me to start immediately gemcitabine cisplatin and see how I'm responding. If not, he will continue to do chemoembolization with me. So I went to Egypt. Originally, I'm from Egypt. I went to Egypt. I met some oncologists there, and he said, immediately we have to start gemcitabine cisplatin. And the result was amazing. The tumor disappeared after 3 months. And I had to go back to Canada and telling them, see, I'm responding to treatments. Please continue the cycles with me. And my first team, they refused, actually. So I had to transfer my whole file to New Brunswick, to another oncology team. He gave me the rest of the cycles, which was 8 cycles in total. I started 3 in Egypt and the rest in New Brunswick. So I finished the cycles, and the tumors disappeared completely. They gave me 3 months off. After 3 months, the tumors start to appear again. I was left 5 months without any kind of treatment. At that time, Bemazir Lymparza wasn't approved for me. So at that point, I returned it back to Dr. Vogel, and he said, stay with me, we will fight together. and he gave me all the hope he can give, and I was responding very well. And last treatments I did exactly a year ago in Germany. And by the way, I had at that time the disease appeared in one lymph node beside the right uterus. So it was stable for a year until he finished all the spots in the liver and everything. And last March, I did the ablation in the liver and on that lymph node, and there is no evidence of disease since then. A year now, I'm off all kinds of treatment now since I was in Germany last March. And here I am.
Wow. That's amazing, Heba. So what exactly did you, what treatments did you get from Dr. Vogel? Who's a different Dr. Vogel than the one who's at UHN now. So it's Thomas Vogel.
Thomas Vogel, yes. He is in Frankfurt. He used to do for me chemoembolization, which is a TACE procedure. And when the tumors became very tiny, he did the microwave ablation. And that's it.
And I guess what should I ask you? I'm not sure.
Yeah, I'll tell you something because it's, you know, I of course, traveling is costly, it's tiring, it's, because, you know, every time I go to Germany, to Frankfurt, I go from the airport to the hospital. And he does the chemoembolization and rest in the hotel for 5-6 days and travel back to Canada. And I used to do that every 5 to 6 weeks to see him for a whole year and a half.
Wow.
Until he finished everything and he did the ablation. And last year, after I came back, I experienced 2 abscesses in my liver and something called biloma. Biloma, it's a collection of bile in like a bucket in my liver. And because it was so difficult to reach, I don't have like a specialist here to follow up with him. When I went to Germany for the last session of ablation, it was on April, he found out the cyst. It was 7 centimeters. He was so sad, so angry. And I was on antibiotic till last week, a whole year on antibiotic until the cyst disappeared and the biloma disappeared. But I had some complication because of the continuous treatments in my liver, which is some abnormalities in my bile duct. Again, I'm facing the system every time since last June. They are expecting that it is the disease. And every scan I do, it didn't show any evidence of disease. So they gave me the least treatments. They gave me some medications to relieve the itching, but not putting a stent. I needed a stent. So they did 4 tries for me to put the right stent. Every time they put the wrong size of the stent. And one of the time immigrated from this place. So I'm suffering from the procedure of putting the right stents until my liver healed after the too much treatments I have done in my liver. I know that everything has a price, and I'm happy that every scan, last scan was February 6th, it didn't show anything, but they insist that it is the disease and it's a matter of time until my bile ducts is blocked by the disease. But till now, there's no evidence of disease. And they took a sample and it was inflammation cells, not the disease itself. So I'm waiting now to remove the last stent that they put, and it was too long. I'm suffering still from the flow in the bile in my liver. I suffer only from itching, but I accept that since I don't see the cancer. I can take that. I can bear that. So, yeah.
Heba, was it only the cisplatin and the gemcitabine that got rid of the disease?
Yes, I got a very good results from the cisplatin gemcitabine. And by the way, I tried to take Bemazir or Lymbarza like a maintenance between the chemoembolization sessions. But of course, I was rejected here in Canada. So I had to go to Egypt to buy something called erdafitinib. But it didn't work, and it had like a very bad side effects. I'm happy to stop it. And what matters for me is the quality of life. I'm living till now a good quality of life since I was diagnosed with cholangiocarcinoma. And my concern about the system here is that they look to the statistics and the resources, and they don't look at the patient. I don't have any underlying disease. I'm very healthy, and I was capable to take the side effects of the treatments very well. Why don't you take care of me? Give me a chance to live. So
worked in the beginning.
so that's the thing. Yeah.
Marlo, did you want to add something?
Oh, thanks, Heba. That's an amazing story. I'm so happy that you're at the place that you're at now, and you fought so hard to find treatment. Is it the case then that the treatment that you were receiving outside of Canada is available in Canada, but they were just not offering it to you, or were you receiving treatments that aren't actually available here?
I have no idea. At the beginning, I thought they don't know anything about the chemoembolization. But later on, I found out that they have the procedure. They can do it. Maybe in my hospital, they don't have expertise or the gut to do it. Because actually, Dr. Vogel, he's someone like, he's like, yeah, he's different. I mean, like he takes, he's bold. He's kind of bold, and although it's a 15 minutes procedure, but the assistants of his always tell me it's a 15 time procedure, but it's very complicated. So my thinking, maybe they don't have the gut or the expertise to do it. This is what I believe in. This is what I believe in my place here in Halifax.
Well, I think it might also be that it is something that happens in Canada, that there are experts who are able to do it, but it might be a question of funding, whether or not the provinces are going to fund it.
Yes, maybe.
And look, from what I have heard is that in general, the Canadian system, it really errs on the side of caution when it comes to, like, they really want to make sure that there's very, very strong research evidence that this is something that is going to help for the provinces to then kind of spend the money on it. So it is a lot of it is very kind of driven by that idea of, you know, trying to be responsible with government money. But then in cases like this, it's where kind of, if you wanted to go and, you know, go out on that limb and try something, that makes it harder to access in that regard.
Yeah.
Thank you so much, Heba. So I'll move this over now to Marlo, who was just asking Heba a question. Marlo is out in Kelowna, BC. And go ahead, Marlo. Do you want to share?
Can I share my screen? I made a slideshow, so
yes.
Just for ease of and helping me remember to gather my information too. How do I do that? Actually, I saw a thing before that said take control. Okay, let me see. No. Do you know how I do that, Christine?
I'm not sure. I can share again, and then you can try and take. Oh no, you would just be taking control of my screen.
Huh. Okay. Well, maybe I won't use it then.
There should be a share button.
Yeah,
right
share
beside
button.
the lead.
Under the more. It's been a
At
while.
the top of your screen.
No.
No.
It might be because
maybe you need to make me a co-host or something, or I'm thinking of Zoom too. This is part of
no,
my.
I know. I had. Oh, I look. I can make you a presenter. There we go.
Okay.
Does it work now?
I'm seeing more options up here. Share. Okay, share content. Share content from camera. Sorry. I'm sorry. Okay, I can't find it, or it's not.
Okay.
It's only showing things that are up on my OneDrive or something. So anyway, I'll just wing it. But at least it was helpful for me to try to get my stuff in order. So yeah, I'm in Kelowna, BC. I was diagnosed with intrahepatic, stage 3, locally advanced, inoperable, incurable cholangio in April of 2021. And I was offered palliative chemo, gem, cisplatin, and I was on it for a year. I had a 10 by 12 centimeter primary tumor in my liver, and then like 4 smaller tumors as well, but no spread. And so I was on palliative chemo for a year, and my primary tumor shrank by over 50%. And at that point, my team here, and I had no spread, my team here was like, oh, maybe there's something more we should do here. And they referred me down to the States for a hepatic arterial infusion pump. So the pump that Christine was mentioning that goes in your belly and delivers 300 times the amount of chemo to your liver with no side effects. Because the shrinkage of my tumor was slowing down. And so their thought was I was borderline resectable at that point after a year, but they wanted to give me the pump to try to get the primary tumor even smaller, so that resection would be possible. My tumor was also close to my vena cava, so it made search. So they were wanting it to move away from that position. So I went down for an assessment, and I was accepted for treatment down there. At the time, my team here told me there would be no funding for it, that I should check through my work to see if there would be funding, which of course there was not. And then I did some research on the MSP, which is like the provincial healthcare plan here. I did some research on the page, and I found an application process for, it was called elective out-of-country medical coverage. And there was a section on the website with an application process for people that my oncologist didn't know about. And so I shared it with her, and she was like, okay, we can try it. So it took a couple, I think from the time that I contacted her with that information to the time that we sent off the application to MSP, that took about 5 weeks, because it needed a letter from the medical director of BC Cancer saying that this was medically necessary and unavailable in Canada. She needed to take it to rounds and have them support it. And I needed a letter from Portland, from the hospital there, saying that I was a candidate. So all of that stuff took about 5 weeks to get together. So then we sent that off, and it took MSP about 3 months to get back and approve the funding. And I think they asked for a bit more information, but I did get approval. It took another 8 months of negotiation between MSP and the hospital down there, OHSU, which is Oregon Health and something University, Health and Science University. So that took a long time for them to sort out the insurance and to set that up. And it was so it was about a year between when I was referred and when I finally got the pump surgery, a year of waiting, because if you have spread outside the liver, you're not a candidate for the pump. So I was very anxious every 3 months getting my scans, hoping that I hadn't had spread and hadn't lost the opportunity to have this treatment, but I didn't. I got the pump in, a year later. So I think that was April 2023. And I had 8 months of treatment with that. And it did shrink my tumor another 25%. And through that year, I was still getting, while I was waiting, I was getting systemic treatment. And my tumor, I had no spread, but it wasn't really shrinking anymore. So that had really slowed down. But the pump treatment got me to, so within 8 months of the pump treatment, which is a drug, there's only one drug approved to be used in the pump, and that drug is not approved in Canada. So I had the pump in. I had to go to Portland every 2 weeks to get the pump filled up. once a month with chemo and once a month just with saline, and I was still getting systemic therapy. So I had to pay for that. So all of the medical things were covered by MSP. I had to pay for my travel. Usually accommodation was covered by the hospital in their patient housing. So I went 18 times in that 8 months down to Portland, and yeah, then I became resectable. So I had a resection in December of 2023, and they removed the tumor, all the tumors. Had 60% of my liver removed, and I was NED for a year. And I'm in the midst of a recurrence right now. But yeah, I got a year of disease-free living. So yeah, it was so much advocacy and frustration in terms of just bureaucratic, like, ineptitude and communication problems. And I'm sure as any of you are in the healthcare system, like asking anybody to do anything that they're not used to doing. So I think that was the hard thing about trying to set up, is that OHSU wasn't used to dealing with Canadian patients. The Canadian system was not used to, and even just things like it would take 2 months to send a disc of scans, like for that to go from BC Cancer to OHSU and get uploaded in the system. It would be lost. They wouldn't have sent it to the right address. They wouldn't have taken it. They wouldn't have uploaded it. It was sitting on somebody's desk, and just like phone call after phone call of me trying to figure out what was going on. So it was, once it got set up, it was pretty smooth. But the process of setting it up was really hard. And it was interesting to me that I was the one who had to find out about that. Like if my team would have just said, this is up to you. And I'm sure it would have been like $500,000, probably, the treatment that I received at least. So that's my story.
Thank you so much, Marlo. Did anybody want to ask any questions? Oh, go ahead, Cynthia.
Oh, thanks. Yeah, Marlo, I'm sorry to hear about your recurrence. I'm wondering if if the next steps involve using your pump once again, if that's the plan.
Yeah, it's a good question. There was a lot of debate. So when I did have my resection, and this is the sort of thing also that would happen throughout, is that I would be told one thing and then something else would happen. And so it was like having to adjust to, but I thought my pump was coming out when they did the resection, and then they didn't take my pump out, and my surgeon here and my surgeon at OHSU don't agree about whether they should have left the pump in, but I have the pump in. I would have had to continue to go to Portland to have the pump filled after my resection, except for I had complications after the resection and I ended up in the hospital. And because of that, they were forced to figure out a way to fill up my pump because the pump can't run dry or else it breaks. So anyway, at least I haven't been having to go back to Portland to have it be filled up. I've had the pump. It seems like my surgeon here, who said they're never going to use that pump again, is correct at this point, because they have not used the pump. It's just been a few months. So I've had 3 months of systemic therapy, and they're talking about trying to do surgery to remove this current lesion that I have. It is interesting. I just saw my oncologist yesterday, and I couldn't really figure out what was happening, but like, I guess because I've had a resection and because I have a pump, it seems like they're treating me like a patient at OHSU still. Like they're really deferring to what my surgeon there wants to do. And my guess is if I'm having surgery, it will be there. So I'll have to go back through the MSP process. I don't know. I had my port removed after my treatment, and then I had to get my port put back in. So I'm all about embracing all the medical devices and never getting them removed, even though the pump kind of is a pain and it does cause me some discomfort. I'm not in any hurry to get rid of it, because who knows, 8 years from now, maybe it'll be the thing that saves my life.
Thank you. All right, Cynthia, why don't you go ahead and tell your story. So Cynthia is from Winnipeg. So we've gone from the East Coast to the West Coast to the middle, and she has been down to the States for a second opinion. And then you've also done some like asking for kind of quotes, I guess, for various different procedures and stuff. So go ahead.
Yeah.
And out of province as well, actually. Yeah.
Oh yeah, I've been everywhere. So I know some of you know my story, so I won't go into too much detail, but when I was diagnosed in 2021 and I did have a resection in 2022, but unfortunately I had a recurrence very shortly after, at which point I was told that there wasn't much that could be done. I would start systemic therapy, but that would likely be a short be a short time. That would give me a little bit of extra time, but that was it. And I think that was the moment at which I decided that that was not adequate care for it, you know, in my opinion. I didn't know anything about the cancer space, but I knew that did not sound reasonable. And so that's when I initially started reaching out to out of province as well as out of country experts. So just finding who the specialists were and then reaching out. So we started with a virtual second opinion at Memorial Sloan Kettering in New York. And then we went further by having an in-person second opinion at MD Anderson with Dr. Jablé. And that's really when things started to turn a corner for us. It wasn't only, I think, you know, Christine, you said it best. Canada is very conservative, and I appreciate the reasons for which they're very conservative, but I feel like the care that I've received, even if it's just second opinion care that I've received outside of Canada, there's a boldness. And I think when we're dealing with a cancer like cholangiocarcinoma, you need to be bold. It's unique, it's rare, it's complex, and so it requires a bold approach to care. And I think the other piece that we found was hope. We immediately, instantly felt hope. As soon as we started talking to doctors started outside of Manitoba, I reached out to Ontario first, but we had this sense of hope again. There was renewed hope that there were possibilities. And then even if we couldn't access them at home today, that still gave us hope because it just meant that we couldn't access it yet. So seeing Dr. Jablé in Houston, that opened up a world of opportunities for us, just in terms of like what you could learn about your disease through testing, through molecular testing, what might be available, what you could pursue. So everything that he raised was not something that could be done at home, but we came back with that information for our team and we said, look, this is what is being recommended by one of the world leading experts. Is there a way that we can make this happen here? And so much like Marlo said, it's months and months and months of advocating and you doing all the work. If there's one thing about patient advocacy, it's that you're doing the work. We have the C3, for example, who are great supports, but really it's you have to be on top of your care. We did in Manitoba here, I've had 4 drugs approved that are not approved for cholangiocarcinoma. We've had funded access to those drugs. And most of it is because I just keep going back down to the States and I keep coming back up saying, well, they're willing to do this. So how can we make that work here? I think part of it is they're willing to be more, I think, more bold in their approach within, because obviously there's certain regulatory barriers, right? But they're willing to be a bit more bold. I've also been down to Michigan for a histotripsy consult. I'm in the process of having a histotripsy consult with Mission Viejo right now. And as soon as I go down and I have those consults and then I come back up, that's another connection for my oncology team here. And I think, my oncologist here, I think she connects with at least 4 or 5 specialists outside of Manitoba. So that didn't happen overnight, but I think me being clear, my husband and I being clear that we weren't settling for what's available right now. Like we wanted to pursue other options. And we haven't had to have anything done outside of Canada just yet. We did have to do some molecular testing prior to that being available in Canada. But we haven't had to do any like surgical or any other local therapy interventions outside of Canada. I have had to leave Manitoba for that. But I found that the more persistent we are, and the more that we reach out to other experts, and the more second opinions, third opinions, fourth opinions we have, the more our team here listens to us, and the more engaged they're willing to be in making some of those bold choices. So I would just encourage, it's like super cheesy, but I always say, like, I wouldn't replace the windows in my house without getting a second opinion. So I'm certainly not going to make decisions about my life without a second opinion. And if my if my team has a concern with that, then I think that's pretty telling, right? So yeah, I highly encourage anyone to reach out to a center outside of Canada and just see, like, what are they doing down south? What's happening, and what could we potentially have access to? Or reaching out to Europe, like Heba did, and seeing what's available out west. Well, I guess depending on which way you're going, but west for most of east or west, whatever, you know what I mean? But what's happening out in Europe. So I think the more that we highlight that there are interventions that exist outside of Canada that we don't have, the more likely we are to see them coming to Canada. Just like histotripsy. I truly believe histotripsy is very likely around the corner in Canada, and that's because there's an influx of Canadians going down south to get histotripsy, right? So sorry, that's sort of a snapshot of me, but I am a huge proponent of getting, at least seeing what's available outside of what you're being offered.
Thank you, Cynthia.
Mm-hmm.
Yeah, if anybody has any questions, please don't hesitate. You can put your little hand up, or just come off mic and ask any of our presenters. I also kind of want to, you all kind of alluded to it. There is a cost associated with going outside of Canada, which can be really prohibitive, right? So knowing that, I think that's another thing. A lot of this does dovetail back into that need to be vocal, that need to create advocacy and awareness that these are things that are important, as a community. So there is a monthly advocacy group that meets. It's 5:30 Eastern every second Wednesday. I can't make it. Leonard's on the call right now, and he kind of helps run those meetings, and is the C3 C3 representative at those. So this is the type of thing. This is also why the C3 thinks it's so important to get that molecular testing done, so that we can help identify those drugs that we should have better access to. Like the olaparib, or like some of the other things that are kind of considered off-label. So the drugs are available for sale in Canada, but they are just not covered for cholangiocarcinoma. And it's things like that is where a lot of the differences between the States and Canada are, because in the States, the FDA will approve the drug for breast cancer, and then if the top doctors recommend that drug be administered to cholangio patients with that same mutation, then all of the different insurance providers will follow that advice, which is not the same in Canada. But it's discussions like this that need to be brought to kind of those decision makers. And I think, as Cynthia has said before, the loudest and most effective voice is the patient voice. Go ahead, Marlo.
I was just going to say, in terms of, I guess, maybe listening to your story, Cynthia, and your story, Heba, and thinking about the response of medical teams to cholangio, and, the same, it was basically like, and I didn't get a second opinion. I ended up having molecular testing, but one of the things that I found, I went to the American cholangiocarcinoma.org conference in last year, and at the time, even though I think I was in remission at that time, I still had gotten the sense from my medical team that if I did have a recurrence, that was basically it. Like that,
Yeah,
you know,
that's
that
what I
would
get.
be end of story. And I, you know, going down to that conference, I heard so many stories of people who've had 6 or 7 recurrences, you know, got to NED, had to come back again, had other treatments. And that was so inspiring to me. And I mean, that hasn't really been my team's response right now, but I don't know if that is in part, as you said, Cynthia, because now I'm part of this kind of momentum or something that does include a system that doesn't tend to give up so easily and that is more bold. So I guess that would be a message for people. You know, like I received a terminal diagnosis and it was like palliative chemo, that's all you're going to get. And this sense like there's not going to be anything we can do. And I just think there are lots of things to do and lots of stories of people who get through this multiple times. And so to keep that hope up and that advocacy.
Thank you, Marlo. Denise?
Hi, thank you. It might seem like a dumb question. It is to me anyway. I hear you went to Germany, you went to Oregon, you went, you know, Houston. How do you find these people? You Google? Like, I saw the advocacy had a presentation last week, and Simon Turcotte from the CHUM was there. So I thought, okay, I'm going to reach out to him because my doctor just gave me a not so cool diagnosis that the tumor has increased and that I got to start chemo again, smack tomorrow. And if the chemo doesn't work, I've got more like 6 months. So I'm thinking, what? Hang on here. So how do you find your experts? That's my questions. Google US experts? So sorry if it's a dumb question.
Not at all. Cynthia, do you want to?
Sure, yeah, I'll speak to that. So not a dumb question at all. And Denise, I'm a teacher, so there are no stupid questions, no dumb questions. You know, one of the really great resources I think is in terms of out of country experts, on the cholangiocarcinoma.org website, the CCF that's located out in the US, they have a list of US experts. And so that I'm not super familiar with. Oh yeah, I'll put it in the chat here. I'll put the link to the list of experts in the chat. Yeah, I'm gonna do that after because I only have one hand and
I'll do it.
Okay, thank you. And now I've lost my my video too. Oh gosh, I'm a mess. But yeah, so I would suggest by doing that. And you know, like I'm gonna deny it if anybody you know, I know this is being recorded, but I'm gonna deny it if anybody repeats it. But I am also in favor of just reaching out to experts. I have to tell you, I have never reached out to someone. A lot of American physicians have their email addresses on their websites. I fully encourage people to reach out directly. I think that there's an impact when you're speaking directly with them and you're sharing your story and asking your questions. I've never had someone not respond to me. I've had someone respond to me and say, "Oh, can you do this in the appropriate, like through the appropriate channels?" But I've never had someone ignore me doing it that way. So I think starting with that cholangiocarcinoma.org link that Christine just shared in the chat is a great way to locate some of the experts. And also, like, you can, I think, anyone with cholangiocarcinoma within Canada, has likely heard of a few here and there. So, because there are a number of really strong centers in the US, but I would start with that link. Yeah.
Cynthia, you had your hand up for something else. Did you want something else to add?
I was going to add something, but I've forgotten. It's fine. I'll raise my hand again if I need to.
Okay.
Thanks. Okay.
Maya? Oh, you have to go off mute.
Okay. Hi, I am Maya. I just want a quick story about my daughter who was treated here in Canada in 2017 when she was diagnosed in 2017 and had the liver resection Year later, she had reoccurrence, and then a year later, again reoccurrence. So the doctor decided that they didn't even offer chemo at that time to her. So she didn't have chemo after resection. And the only thing that we were told that the only option is going to States for transplant and the trial there. So it took us a month. We were not approved for this. So she was, at the time, she's married to Israeli. So they moved to Israel, where right away they started treatment. She got right away the targeted therapy, which wasn't available in Canada. And since then, she's been treating in Israel. And so it's been 8 years. I want to just give a hope to everyone. Don't take the answer from the doctor that that's it. There is nothing else we can do if something is not working. Because like I said, she's been 8 years. She's doing okay. She goes from treatment to treatment, but she's doing okay. And so there is always hope for, we research lots of also in Germany. We talk to doctor in Germany. We also talk to doctors in Brazil. So we still Google and we Google and Google and Google all the time and reaching to any doctor who has some impact or some experience with cholangiocarcinoma. And it doesn't have to be big one, because some of them, they might not have lots of experience, but they still have lots of interest and they do some research as well, and they might be helpful with a new treatment. So don't give up. I am not planning to give up on my daughter. Actually, I am flying right now to her in April. For a few months, I go back and forth all the time, and I believe that miracles happen, and when the doctors are on top of it and they are willing to help. Unfortunately, I am not happy with system in Canada, and I miss my daughter going there, but she is where she's supposed to be and get the best treatment.
Yeah, and I think in defense of the Canadian doctors, I think a lot of them don't like the Canadian system.
I know.
They are very hamstrung as well in their own way. And I think like with Cynthia, Marlo, and Heba, just being clear with your doctor about why you're going somewhere or what. And I think eventually I think they do kind of come around and know that it is kind of it's always for what's best for you, right? And I think we are in more of a time where it is kind of more allowable to kind of question your doctor more than maybe in the past when the doctor knew everything. Now we have Dr. Google, or at least we have the ability to kind of search a little bit for ourselves, reach out to other places, and it can be something that is helpful to the doctor. Like, these doctors are often very overworked, and if you are able to kind of find some information and bring it to them, they can put that medical lens on it and kind of give their opinion on what you have found. Ultimately, it's always your choice. Go ahead, Heba. Go ahead.
Think that even Monica's, my daughter's doctor, he even said at one point, you need to leave Canada for treatment. You're not going to get the best treatment here. He was honest. He was fighting for her as much as he could, but he said, you're better off somewhere else. It's sad, but that's true sometimes.
Yeah. Heba?
Yes, regarding the questions, how I found Dr. Vogel, we had a friend living in Germany for a very, very long time. And then when he heard about my story, and before that, I reached MD Anderson, and I found that I had to put like $100,000 upfront before I go there and do anything, and they will start everything from scratch. He told me, don't worry about that, Heba. Germany is not the United States. Come over. I showed Dr. Vogel your scans and everything, and he said there's too much hope. So the first day I saw him, he gave me hope. And after I finished treatment with him, he said to me by word, Heba, you will live 10 years more. Last year, he told me that. And he told me, I believe it's not going to come back again. And and I told him, well, Dr. Vogel, that's not the statistics. And he said, well, there is God. So I believe in prayers, and I believe that God listens. And Of course, I have to take all the means that I can to reach out my goal to treat myself. But above all that, there is God. So God can save us. So no lose hope ever, ever.
Thank you, Heba. Mary? There you go.
My hobby wanted to talk.
Yes, this is really our first foray into hearing this. One thing, like before I get in, Mary's the one who had the cancer, but what I'm hearing here is, I don't know if it's disturbing but is it the cholangio cancer is getting the stay away, or is it like if you go in with lung cancer or breast cancer, you get treated the same way as what I'm hearing here with the cholangio?
So cholangio is such a rare cancer, and in the past, when a new drug, so a lot of the things that we're talking about with the off-label, it's because these targeted therapies target a mutation. And when they originally came out, the more common cancers, so colorectal, prostate, breast, and lung are the top four. They would find this new drug, and it treats breast cancer, but only the breast cancers that have this mutation. And so when they did all the clinical trials, they only tested it in breast cancer. And so when they went to Health Canada, or even in the States, the FDA, to get the approval for this drug, all of the evidence was just in breast cancer. And so that is why that drug is approved. And it's covered because it's been shown to work so well just in breast cancer. And nowadays, there's been a huge paradigm shift, so that they're called basket trials, so that they're really testing any cancer with this mutation. So in the fullness of time, the poor little, like, rarer, less known cancers will be included in that basket trial. So when these drug companies go to Health Canada or go to the FDA and say, we've got this great drug, it works really well for tag 3. And so any cancer with a tag 3 mutation, which I just made up, would get approved for use. So in the meantime, it's that question of, can we get access to those already approved drugs? And then when it comes to different treatments, again, it is just, whether or not these treatments are fairly new in the States, and because of their structure, because of their healthcare structure, it's easier and faster to put those types of expensive machines in place and start recouping the costs. Whereas in Canada, it has to go through a whole long approval process for the province to essentially spend, millions of dollars on a machine. And
it seems almost like you're educating your healthcare team. That's what everyone here seems like. I've started that kind of thing with Mary's oncologist, and but I'm having hesitancy. Do you piss off the team? Who is this guy coming in here telling me how to treat his wife's cancer or something like that? Do you ever get that kind of a like Cynthia said, if you get that kind of reaction, you're in the wrong place. That's what I heard from that. Yeah.
Yeah, I mean, I can't personally speak to that. If anybody else wants to come off mic and respond to that, what I would say is that, that in my opinion, that's where it's the doctor's ego that's coming into play. Yeah. And you just have to remind them, look, we're all on the same team here. We are all trying to do what's best for the patient. Yeah. And I am going to do what I can do as a layman to find some information. I'm going to bring it to you and say, like, what do you think about this? Or can we go from here? And, it has been said, I've heard it said many times, that cholangio patients end up becoming, the more like experts in cholangiocarcinoma, more so than their doctors. Depending on where you are, your doctor may be more or less specialized. And so if you're not in a big city center, then chances are your doctor doesn't see very many cholangio cases. Yeah. And so we're
lucky here.
Yeah.
We're in St. John's out in Newfoundland, but the doctor we have here I think she's very open to this. She has a PhD in genetics and stuff like that, so I think she knows what I'm like, so I think we'll get along well. So the other thing that a comment is when you were saying about the Canadian system being very conservative. Mary's on the adjuvant now, what's it, capecitabine. And the other day we went in and like we were saying, or she was like how good she's doing on it. And sometimes we say, well, it's not working, or, we're just making a little joke like that, how she's doing so well. But the doctor actually went away and came back and said, well, the original studies done on this were done in Asia at a higher dosage rate. And when you're back in North America, the dosage rates are lower because people are complaining about it. So I asked that question the other day. So now Mary's dosage is upped to what the study was in Asia.
So I'm a post-resection. I was a stage 2 and I was caught very, very early, just to give you a little bit of background. So I'm on capecitabine now. So no, this is my second cycle. I just started yesterday or Tuesday. So, I mean, the first cycle, I had no issues at all. So I was on 1800 milligrams, and that's a pill form. So, so then, yes, and this is what the oncologist was saying about how, it can be increased. And when we found out, the pharmacist here, sure, you can go up to the 2150 milligrams, which, so why not give me the max? So yeah, like my husband just said about in Asia and so places like that in Europe, they're doing that. So anyway, and I look, knock on wood, 2 days later, I haven't had any side effects. And so yeah, and again, like I agree with all your points. You have to be your own advocate. I'm a nurse myself, so I am in the system, which is great for me because I do know how to navigate around a bit. But in terms of going outside, like you guys just mentioned, I think that's a great idea, and to do the research. And Cynthia, I hope you do send that information to us about if I ever have to do that. I count myself lucky just because mine was related to a fatty liver. I had an ultrasound, so over the years, COVID put a little bit of a spin on it. Then afterwards, I ended up getting an MRI. I just got a letter in the mail one day to say, you got to have an MRI. But I waited a good year and a half, almost a year and a half to get my MRI. I was at work one day on a Friday, Monday, I get a call saying, come up to the doctor's office. You have, looks like a malignant tumor. Unfortunately, mine was right next to the inferior vena cava at the time. We're thinking it was a stage 1, not sure. They were saying it was a budding it. And anyway, the doctor here, my surgeon here, he is a liver, hepatobiliary surgeon and so on, but he couldn't do it because it was so close and risky. So I had to go on to gemcitabine and cisplatin and the immunotherapy, which didn't actually work for me. So because to shrink the tumor away from it. So anyway, I got referred to Toronto. So I had to go to Toronto General in December, had my surgery, very successful, doing fabulous, wonderful, but now the margins, and they had 2 hepatic veins. But by then, I guess over a period of 6 months, because I was diagnosed back in June of 2024, I should have said that. So in December, I had my surgery. Doctor called me in November. This is Dr. McGilvery. I don't know if any of you guys know him up in Toronto. And he said, we need you up here as soon as possible. Because I went up, in actual fact, I went up there in November to get a CAT scan done because he wanted his own images, which I was grateful for because by then it was pretty much a stage 2. He was afraid that it was going, and it wasn't spreading anywhere else. Luckily, it was at, status quo where it was. Well, it actually had wrapped around. No, that's a lie. Sorry.
Yeah, that wrapped around the vena cava and then out over the 2 hepatic veins.
2 out of the 3 hepatic veins. So anyway, we went up December 8th, got my surgery on the 13th, was in hospital for 11 days, did wonderful. Had a few complications with a bit of fluid around my lungs and so on. But then after that, yeah. So now I'm on the capecitabine, and so far so good. So that's my story. Anyway, seeing that this is our first time being on
Are you, Mary, are you
Prevent-
on the capecitabine because just as a precautionary, or
preventative? Yes, sorry, yeah,
so they
preventative.
didn't get an
And
R0? They didn't get an R0 for you when?
no, no,
Okay.
I'm an R1, and it's just to prevent any microscopic cells, from getting out there. But seems like you got it all right. So yeah.
So yours is
Yeah.
hepatic as well?
Yes,
Intra.
intrahepatic.
Mm.
Yeah, same as Marlo's. And Marlo, I'm sorry I never got to hear the rest of yours because our daughter called and she's away. She's in Europe actually, so sorry I never got to hear the latter part of your conversation. I was
Yeah.
interested in that, but anyway.
That's two of us. I'm from Newfoundland as well. My wife has been dealing with cholangiocarcinoma now
Oh, okay.
since January of 2029, or January of 23, January 29th of 2023.
Oh, okay.
Mm.
All right.
Does she have resection or anything, or?
Yeah, but she ended up having to do 2 rounds of gemcitabine and cisplatin, and it actually worked for her. Twice it shrank.
Really?
23,
Okay.
it shrank less than half, and she probably could have had surgery back then. But they found a mysterious bump on one of her vertebrae, on her L3 vertebrae, about the size of the top of a writing pen, and they classed it as metastasized. But it didn't move for a whole year after. She went back on cisplatin and gemcitabine because obviously it only shrinks it so far. Then you take your break because you can't take anymore. In 2024, she did 18 treatments, and it shrank again. But we had through Christina and Dr. Au on the C3, they took our case. Dr. Au took our case through her tumor rounds and passed it back to our oncologist in St. John's, and we ended up getting eligible for liver research January 30th. So my wife just had liver resection in St. John's. 2 surgeons in St. John's did it.
Oh, yeah.
Hogan
and Quigley.
and Quigley. Yeah.
Yeah, yeah. They're really good.
Is Hyde
Yeah.
your oncologist too?
No, I have Siddiqui.
Oh, Siddiqui.
Steve, he's really good too. Yeah, yeah. They're good. Actually, they're really good surgeons.
But they're all the same, and everybody from all over the country is saying the same thing. They're caught in a box, and they only have so many
They are.
tools to use, and you got to
Exactly.
push, and
Yep.
there's so
Yep.
many good organizations out there like the C3
Yeah.
and Brenda Clayton. I don't know if you met her out in Red Deer. She's got a cholangiocarcinoma, hepatic liver charity. There's so much information out there, and usually in a couple of places, because you only
Yep.
got so much time, you can collect a lot of information in a short period of time.
Yeah, yeah. Well, I hope
Yeah.
your wife does really well now post surgery.
Yeah, well, she too she ended up with a bag on her side because of an abscess that developed. But we're hoping to go in and get it taken out tomorrow, actually. So.
Oh, good,
Excellent.
good. Yeah.
All right.
Yeah,
Thank you,
these are good.
Mary. Cynthia, did
Okay.
you have something else? You still had your hand up?
I'm just going to be super quick in the interest of time too, and I've said a few things, but I did want to speak to one thing that Mary's husband said. I'm sorry, I can't remember your name. So one of the things that I always raise with my team, I've had a very supportive team here. They've obviously had certain barriers, but they've been very supportive in terms of me reaching out for care outside of Canada, outside of Manitoba. But one thing, whenever I met, and it's not often, but whenever I met with someone that maybe isn't super keen on us exploring things outside of the box, let's call it, I always say, what would you do if it were you? Or what would you do if it was your daughter? Or what would you do if this was your husband? Like, I know you would do absolutely everything in your power to change this. And as soon as I say that, I almost always have someone, willing to go to bat for me. And I just wanted to share one other super positive, hopeful story too. So I've been stable for 15 months. I've just learned that I have disease progression. It felt quite crushing after all this time back and forth on medications. And I really felt like I was going to have to do another, let's call it a battle with the system. But this time I had my appointment with my surgeon here, And my surgeon said to me, you don't have to take the reins anymore. That's what we're here for. And we're going to figure out how we're going to address this new lesion. And they have completely taken over. They're collaborating with Toronto. They're establishing they're going to try something in Manitoba that they've never tried before surgically. So I think like there's hope in that too, in that when all this started in 2021, I didn't feel very well supported in terms of trying novel therapies or my team taking reasonable risks. And here I am 3.5 years later, and my team sitting me down saying, okay, like this is what we're here for now, and let's all do this together. So I think that there's so much hope. And I think that everyone on this call has access to things, whether they're here in Canada or outside of Canada. We have access to things that we didn't necessarily have when Heba and Marlo and I all started our journey. So I think that's important to make note of as well, because it's that I find more hope every day as things are discovered and as things become approved and as we have more information, right? So I just wanted to make sure that everyone heard that there is lots of hope. Yeah.
Thank
When
you.
you reach out for a second opinion.
test?
Could I ask a question?
Okay, go ahead.
Have you had the molecular test, Mary?
No, I'm trying to get some testing done up in Toronto. Actually, I'm waiting on a call. So because I did participate in the research study, and when I had my surgery, they took some, liver. So I'm just waiting to hear back now.
When she got her surgery,
Really
it was
important to get that molecular test.
Yeah.
Really
I
important.
know, absolutely. Yeah.
When she had her surgery in Toronto, she was not automatically, but she registered with
Yeah.
the Grayley registry up there.
Yeah.
And they were going to do genetics, but the way her tumor was intergrown around the vena cava and all that stuff, it didn't quite meet the standard for getting the genetic. But we called them up and were adamant that we want something done. And they're going to pull the tumor again and do whatever they can with it, some kind of biologics or molecular test.
Because mine was a 5.8 centimeter. So just because they didn't realize it was that size, right, when I had my surgery. So
Yeah, my wife started off at 10 centimeters, and it shrank down below 5 twice.
Wow.
Amazing.
Yeah.
Does
Heather
it cost
and Ivan?
anything for
Oh.
Does it cost anything for a second opinion?
Wait.
Well, that's a good question. If you are referred within Canada, no. But if you want to go on your own to the States, then yes. So there are some virtual second opinions that, Memorial Sloan Kettering, Cynthia went through. There are a few other ones, and they cost around $2,000 to $4,000. I've seen a few of them. I find them quite rote, and they're not really going to be envelope pushing. I think the best thing to do would be, if you really wanted like a true second opinion, would be to kind of try and reach out to get a one-on-one with an actual physician. They usually want to see you in person though, and then the costs are kind of over 10,000, I would say. I don't know exactly. But.
Okay, thanks.
Yeah. Well,
yeah, I'll just move on to, we have two more people with their hands up, and I know we're already over time. So Heather and Ivan, did you want to come off? There we go.
Heather's just past her third year anniversary with this illness. We've been quite pleased with Heather's care to this point. Her last scan showed that she was stable. She's on Folfox. She's just completed round 15 on Folfox.
Amazing.
She has another scan coming up in a couple of weeks. I guess, and we've talked about going to the States. We've talked about, she's had a second opinion from.
Now, did they freeze or did I? I'm not sure.
For two reasons, we've been kind of frustrated with doing anything creative because we're older. We're both in our late 70s. Heather does have a comorbidity. She has an issue with her kidneys. So every time we get second opinion, we're told, well, there's no actionable mutations. She's had one genetic testing. She's having another just to see if anything has changed. But we're wondering, at what point do we decide to pursue international options? right now, we seem to be just progressing as we're supposed to according to standard of care. So we're kind of perplexed. Would there be any purpose in going to Houston or New York or where Philadelphia or whatever? How do you know when?
Oh, you're breaking up a little bit, Ivan.
Losing it again. As long as things are stable, we'll just stay the course. But when things do progress, well, then we have other options. But that's not quite the answer we were hoping for. We were looking for a bit more precision in the answer. And so that's what's on our mind. Do we just continue to be patient, or should we, at some point or other, pursue some more creative options?
Did anybody want to respond? Cynthia, did you have anything? Or
I can respond to that.
Hi, B.
Hi there, everybody. My sister has intrahepatic stage 4, told inoperable in metastasized in her liver and lymph nodes. So we are from BC, and I have to say, listening to everybody, I think BC has got to be the worst for getting any support. I don't know if you agree with that, Marlo, but anyways, to make a long story short, we've gone to Houston, and we've also gone to California. We went for a second opinion in Houston because our oncologist here is quite negative, basically told my sister she's got 1.5 years to live and to get her things in order. So that was unacceptable to us, and we were going to fight it. So we went there. Now, since then, she's been more, she's been kind of working with us with whatever we're supposed to go see Dr. Javli, but we ended up seeing a different doctor because Dr. Javli had to cancel on us. But to make a long story short, I just want to say that the second opinion, it did not cost us $20,000 or $10,000. Probably cost us, by the time we paid our hotel and everything, probably I'm going to say somewhere around $8,000. I think we had to put up $20,000 at first, but then but we ended up getting a bunch of money back. Then we went up, our doctor now, she can't even, we brought up the histotripsy opportunity. She couldn't even pronounce the word, knows nothing about it. We went, and my sister had histotripsy on January 10th. So if anybody wants to talk to me about that, I'm happy to share. It's $50,000 US. We paid out of pocket. What I wanted to share with you right now was that we are going to apply for reimbursement. We are not going to get it. I know that we're not going to get that. But the reason why we're going to do it is, I think, because there's so many Canadian patients that are going to get this procedure. It's non-invasive. Literally, they just mark you up with a black felt pen, and you have the operation. It's all ultrasound, so they don't even go in, cut you, nothing. And you get up after the operation and you walk back to your hotel and you're done. And we flew home the next day, and that was it. They got probably up to 50% of the tumor shrunk, just to make a long story short. Anyways, but so back to my reimbursement thing. The reason why we're going to do it regardless, and we did it before, we didn't get the approval before. We kind of did it half backwards or whatever, but is to sort of show the government or get enough people to do this so they can start hearing us, that all of us are going outside of Canada to get treatment, because there's nothing here. They don't offer you anything. And right now, if we have to go into second line treatment, we have to pay out of our pockets anyway. So if I'm going to pay out of my sister's going to pay out of her pocket, I mean, we might as well and most people don't have that opportunity to do that. My sister's very lucky, but you know what, we're going to go to the best, and they are so informative. They call us on a Sunday afternoon. I had my post, on at 2:00 I call him on my cell phone. He's calling me from his cell phone on his way home. Like, it is unbelievable, the care that you get. I can get an appointment. I can call MD Anderson, send them a little note on their portal, and within 2 days I have an appointment. Like, it's unbelievable. I can't even get that with my just family doctor, let alone oncologist. And then when we did approach to try and get an oncologist who is a specialist with a CCA specialist, they told us that we don't get to choose. So, and that's just shows you how overwhelmed our system is. So, I mean, we're so bad, like we're just totally not, you know, we're, what's the word I'm looking for? We're just, I'm not impressed with our Canadian system, especially in BC. So everything we're doing, I mean, we're going outside to get the help that we need. But I mean, they are willing to work with us a little bit now, but they just kind of listen, and then we're telling them what we need to do. You know, so it's the opposite of what, like, we're the expert versus, you know, what we should be getting. So I just wanted to share that.
Thank you so much, Bea. I think maybe we'll do a session specifically on histotripsy.
Sure.
In a month or two. I'll reach out to you.
Yeah.
I think I feel the need to just, you know, to defend the Canadian healthcare system a little bit.
Yes.
We are talking about a very rare disease, and that is where we see the cracks and the problems in the Canadian system. I think overall, for, you know, if you look at, you know, like rich to the poor, Canada has a very good, robust system that really does help all the people. You know, if you look at the average person in the States, they do not have the same type of coverage that we just de facto get. We are talking about a very specific, very rare cancer situation. It's still not acceptable, but I just, you know, we're not trying to completely rag on our, you know, on our healthcare system. So, but I really do see where you're coming from, and that idea that there are things that are so much more accessible, you know, in this sphere elsewhere and not in Canada.
And I just will just into that, you know, the younger our oncologist did have to go on a leave, and we ended up getting some younger doctors, and they were really, I have to say, we were much more happy with them, and they were more apt to try different things and listen to us. And that made us feel so much better that we were at least had, you know, they weren't specialists in it, but they were open. And that's all we were hoping for, like just somebody who's open and willing to try some and listen to us. So, you know, hopefully maybe it's just a matter of switching oncologists, but she's back now. So we're dealing with that. We'll see. Hopefully she's on board, but so far so good.
Yeah, so I know we're well over time now. I'll just wrap up by saying thank you so much to everybody who's come and listened and participated. We do still run our monthly support groups with the Cholangiocarcinoma Foundation on the fourth Wednesday of every month at 4 p.m. Eastern, 1 p.m. Pacific. So you're always more than welcome to go to those. I'm going to continue to kind of host these C3 chats, which are more informal than a real webinar, just talking about various things that are of more Canadian specific import. I highly recommend going back through the Cholangiocarcinoma Foundation's webinars. They do have a really good one I posted in the chat about histotripsy. And if you do have any ideas of things that you would like to talk about, you know, in this Canadian context, please reach out and tell me, and I will kind of add that to the list. Other things that we've got coming up are one of the ones would be looking at naturopathic complementary medicines to go kind of alongside the traditional medicines. And I also have a book club that will be starting next Monday on the book Radical Remission, which some of you might have already signed up for. It's a book written by a PhD who interviewed a whole bunch of different people who had a radical remission, which is defined as a remission kind of against all odds, so against the statistics, and what did they all have in common. And so she kind of lists the 9 themes that came up. So we're going to kind of discuss that. A lot of those things kind of come up regularly anyways. I'll give another little plug for Meet C3. We are hosting a 3-day event in Toronto at the beginning of April, I think 4th, 5th, and 6th. In-person has closed, but if you are interested in attending virtually, the Friday is a full-day event talking all about biliary tract cancer care in Canada. We've got a bunch of really great speakers, and there's going to be Flavio Roca from OHSU is going to be talking about hepatic artery infusion, as well as Paul Karanicolas, who is the Toronto doctor who is currently who's currently doing hepatic artery infusion surgeries at Sunnybrook. And then the week after that, April 9th to 11th or 12th, that is the Cholangiocarcinoma Foundation's annual conference in Utah. Again, you can attend virtually. And I highly recommend kind of trying to attend any of those. There's a lot of good information there. Leonard runs the advocacy groups. It's every second Wednesday of the month. All of this information, if you don't have it already, I can provide it for you. Thank you again for attending. And if you do have any other follow-up questions or want to connect in any way, then please don't hesitate to reach out. Thank you so much, everybody. Take care.
Thank you, Christine. Yeah.
Bye now.
Okay.
Hang on then.
I'd like to get
Leonard, why were you?